Welcome back to the third part of Module 3. In this part, we'll discuss measures of reliability. So what is reliability? Reliability refers to the consistency of a specific measurement. Reliability can be discussed in terms of raters, that is, the people or person who is conducting a measurement, instruments, or testing procedures. However, regardless of how we are talking about reliability, the global take-home point is that measuring reliability allows us to establish whether a measure or procedure produces results in such a manner that are reproducible and internally consistent. In other words, reliability is important because it allows us to ensure that observed changes are due to an intervention and not a problem within a measure or a procedure. If we had an unreliable measurement, it is highly possible that the size of the benefit from the measure could be overestimated or even underestimated. Let's take a look at an example. Let's say we want to know how a joint mobilization intervention affects a patient's level of function. We have the patient complete the foot and ankle ability measure, which is also referred to as the FAM, and then we implement a 2-week joint mobilization intervention. At the end of the intervention, we have the patient complete the FAM again to determine if there were any changes in their perceived level of function. However, if the FAM was not a reliable instrument, how can we be sure that any noted changes in function were due to the intervention or were due because the FAM did not produce results that were reproducible? To further simplify our examples, let's think about reliability more globally for a minute and think of some examples of instruments we use every day to measure a dimension. Some of the most obvious examples are a scale to measure weight, a clock to measure time, a speedometer to measure speed, or a thermometer to measure temperature. Throughout daily life, do you think there is a perfectly reliable instrument? We know that there are slight deviations in some of the instruments we use on a daily basis, such as time. Right now, is the time on your computer, cell phone, watch, and nearby wall clock all identical down to the second? Probably not. However, error is okay as long as it only accounts for a small fraction of the observation. Therefore, when we discuss reliability, we want to focus on 2 specific concepts when we want to determine if a measure is reliable: reproducibility and internal consistency. Before we get into the specifics, let's return back to our archery example that we discussed when talking about concepts of validity. Remember, we identified that validity aims to determine if something, such as an instrument, research design, or intervention, measures or achieves what it is intended to measure or achieve. In our archery example, we discussed that a valid archer would be someone who can hit the center target. Reliability, on the other hand, as we just identified, focuses on the consistency of a measure. So, in our archery example, a reliable archer would be someone who could consistently hit the target in the same area over and over again. Let's look at the targets on the slide from left to right. On the far left, we can see that this archer is very reliable. Although they are not valid, because remember, a valid archer would hit the center target, this archer consistently hits the target in the same area. The middle 2 targets, on the other hand, display an archer that has low to no validity and low to no reliability. They were not able to hit the center target, nor were they able to consistently hit the target in one area. Finally, the target on the right shows an archer that is both valid and reliable. Not only were they able to hit the intended center target, but they were also able to do it consistently. First, let's discuss reliability in terms of rater reliability. Remember, the rater is considered to be the individual who is collecting the measure. When we think of rater reliability, we can divide it into 2 separate types: intra-rater reliability and inter-rater reliability. Intra-rater reliability refers to the consistency of data recorded by one individual across multiple trials. Intra is the Latin root meaning within. The most common example to help you remember the meaning of intra is to think of college or university intramural sports, which all occur within one college or university. So, going back to the form of reliability, intra-rater reliability addresses how consistently we ourselves are able to conduct a measure on several occasions. Let's take a look at an example. Let's say a clinician we'll call him Rater A, wanted to measure range of motion at a given joint, but wanted to ensure that he had good intra-rater reliability. He measures the range of motion over 3 trials for 4 individuals. That is, the rater performs the same range of motion measurement 3 times on each of the 4 individuals. Based on the numbers here at a quick glance, it would appear that Rater A is consistently able to measure range of motion at a given joint for each subject. Therefore, it is plausible that he has good intra-rater reliability. Inter is the Latin root meaning between or among. A good example to remember the meaning of inter is to think of interprofessional collaboration, which involves the collaboration between or among individuals from various professions. Therefore, inter-rater reliability refers to the consistency of data recorded by multiple raters who measure the same group of subjects. For example, if you are going to have multiple clinicians assess balance via the Balance Error Scoring System, or BESS, during pre-participation physical exams, you would want to ensure that the clinicians were reliable. In other words, you want to be sure that all clinicians would achieve the same score for an individual. To assess the inter-rater reliability, you would have at least 2 raters score the best on multiple individuals and then assess the scores they achieved to determine if they are reliable with one another. One important thing to note here is that before you establish inter-rater reliability of a measure, you want to ensure that there is good intra-rater reliability. If an individual clinician has poor intra-rater reliability for the BESS, that is, they cannot consistently reproduce the same BESS scores for one individual, then it would be difficult to assess their ability to score the BESS as compared to other individuals. To measure rater reliability, the intra-class correlation coefficient, also called the ICC, should be used. While we are not going to focus on an in-depth understanding of this statistical test at this time, it is important to cover some basic features of the test to help you interpret the values you may come across when appraising evidence. To begin, it is important to highlight that the intra-class correlation coefficient measures the strength of association between 2 measures. More specifically, it measures the strength of agreement between repeated variables, that is, more than 2 repeated time points. There are 6 different types, also referred to as equations, of the ICC that take into consideration the purpose of the reliability study, the study design, and the type of measurement taken. We will not focus specifically on these equations, but it may be useful for you to have an understanding of how to interpret the ICC. When we talk about interpreting ICC values, it is important to know that the values range on a scale from 0 to 1. The closer to 0, the lower the reliability, or, on the other side, the closer to 1, the higher the reliability. According to Portney and Watkins, an ICC of 0 to 0.5 is considered poor reliability. 0.51 to 0.75 is considered moderate reliability. 0.76 to 0.90 is considered good reliability, and 0.91 to 1.0 is considered to be excellent reliability. Another form of reliability you will frequently come across when appraising evidence is instrument reliability. When we talk about instrument reliability, we want to focus on both reproducibility and internal consistency. With reproducibility, we ask the question of, if a measure was repeated, would the same results be achieved? For example, do scores on a patient-rated outcomes instrument remain the same when a patient's health status is unchanged? Given that everything in that person's life stays the same, does the instrument yield the same results on repeated occasions? To measure reproducibility, we want to use test-retest reliability. Test-retest reliability is easiest to think of when you're trying to determine the reliability of a knowledge assessment. You'll give the participant the test once, and then again at a predetermined period of time later to see if they select the same answers as the first time. For example, if we are going to assess the global rating of change, we can give the individual the single item outcomes instrument, and then give them the same single item instrument at a predetermined period of time later to determine if their health status is better, the same, or worse than the last assessment. Typically, we administer 2 test periods sometime between 2 and 14 days. When determining the length of time between administering the 2 tests, you want to consider what the instrument is assessing, as well as what things may naturally occur that could influence an individual's score. If the time between testing period is too short, you may encounter answer fatigue or memory issues, meaning that the individual remembers how they responded the last time, and therefore are answering the second time based on their previous response and not the current truth. On the other hand, if the time between administering 2 tests is too long, natural changes might actually occur. For example, if we were assessing the reproducibility of a health-related quality of life instrument, if we waited too long between the 2 testing sessions, it is possible that the individual's health-related quality of life may naturally have changed. Therefore, their answers may have changed, and we would not be able to determine the reproducibility of the instrument itself. Similarly to rater reliability, the preferred method to measure reproducibility, or retest reliability, is the intra-class correlation coefficient. However, another option would be to use percent agreement. Percent agreement is one of the simplest forms of reliability assessment and involves the sum of observed agreements divided by the number of paired scores obtained. For example, let's say we want to know the percent agreement between 2 raters who each subjectively assess 100 individuals' hamstring flexibility and places them into one of 2 categories, within normal limits or not within normal limits. If we were to look at the following contingency table, we can see the number of individuals who were placed in the within normal limits category for each rater, and the number of individuals placed in the not within normal limits. From this table, we can see that of the 100 individuals that each rater assessed, the 2 raters agreed on 60 individuals who scored within normal limits and agreed on 15 individuals who scored not within normal limits. Therefore, there were a total of 75 observed agreements. So, if we divide the 75 observed agreements by the total number of possible agreements, which in this case would be 100 since 100 individuals were measured, the percent agreement between these 2 raters is 75%. Thus, while percent agreement is the simplest form of reliability, it does not take into account the number of observed agreements that may have occurred by chance. With instrument reliability, we also want to focus on internal consistency. Internal consistency assesses the characteristics of a group of items. In other words, internal consistency is related to the relationship of a subset of questions that are aimed at assessing the same dimension, such as physical, mental, or social dimension. Essentially, with internal consistency, you want to ensure that there is more than one question on the instrument to measure the intended dimension of health. By having more than one question focusing on the intended dimension, it allows us to collect several measures of a construct to produce a more reliable estimate than just one measure alone. For example, if we want to assess the functional ability of someone with a lower extremity injury, one question may not capture the full spectrum, but a subset of questions related to functional ability may help to capture the overall picture. It is important to note that all items or questions included in the instrument related to the same dimension should be homogeneous, meaning they should all measure the same thing. Going back to our example, all of the questions in the instrument should pertain to the functional ability of the lower extremity to be able to measure that specific dimension. Internal consistency is most often measured by Cronbach's alpha. Again, we are not going to focus on the specifics of this statistical test, but it is important to understand how to interpret Cronbach's alpha when appraising the available evidence. Cronbach's alpha values range from 0 to 1. The higher the alpha value, the higher the internal consistency. In particular, values around 0.90 are considered to be highly reliable. Furthermore, an instrument is considered to have strong internal consistency when the Cronbach's alpha value is between 0.70 and 0.90. However, it is important to consider the meaning of a Cronbach's alpha value if it is either too high or too low. If the Cronbach's alpha value is too high, it is possible that the questions or items on the instrument end up only measuring a very narrow aspect of the dimension and therefore may be considered redundant. If the Cronbach's alpha value is too low, on the other hand, it is possible that the questions or items within the instrument are too broad and may be measuring different ideals. The kappa statistic is also used to measure internal consistency when the data of the instrument are nominal. As a refresher, nominal data are classified into predetermined categories such as sex, leg dominance, blood type, or highest educational degree. Nominal data are mutually exclusive, meaning that the subject or characteristic can only fit into one category. For example, it is impossible for an individual to have a blood type of both type O negative and type A positive. Kappa values range from -1 to 1, although the range from 0 to 1 is most common. A rating of 0 indicates that the agreement is no better than by chance. So, in summary, remember that reliability addresses the reproducibility and consistency of a measure. We can think of reliability in terms of rater reliability, instrument reliability, and even the reliability of a particular procedure. More specifically, if a procedure was used in a research study and produced great findings, but then when conducted for a second or third time, that same procedure was unable to reproduce the same results, would we really be able to trust the value of the procedure itself? Furthermore, if a procedure was found to be effective, but only in a controlled laboratory setting, would the findings from the study have any weight with us in the clinical practice arena? Therefore, when you are praising the evidence, such as a research article that may help to answer your clinical question, you need to consider whether reliability needed to be addressed for any particular aspect of the study. Did the researchers use a measure or instrument to collect data in the study? Or did the collection of data rely on a rater to collect it? If so, then the authors of that research article should have discussed the reliability of the measure or instrument and indicated whether the rater, measure, or procedure was deemed reliable. Also, if reliability was addressed, you'll want to consider if the authors used the appropriate statistical test to establish reliability. This consideration goes back to the statistical validity. If the authors reported the reliability of an instrument by using a Cronbach's alpha, but the data measured from the instrument was nominal, which we now know we would want to use the kappa statistic for, then it is possible the incorrect statistic was applied, which would create a potential threat to the statistical validity. Confirming that the raters, instruments, or procedures used in a research study are reliable is necessary to ensure we can trust the findings of the study and therefore consider the applicability of these findings to help us answer our particular clinical question. This concludes the third module of the home study course. Please proceed on to the fourth module, which will focus on levels of evidence and strength of recommendation. Thank you.